Imagine waking up one morning and realizing that sounds around you are suddenly muffled, or perhaps one ear just isn't hearing things the way it used to. This isn't just a minor inconvenience. It's a signal your body might be sending you that deserves immediate attention. If you experience sudden hearing loss, the answer is a resounding yes. You should see a doctor immediately. This is not something to wait on, as it is considered a medical emergency that requires urgent attention and evaluation from a healthcare professional. The primary reason for this urgency is the potential for a condition called sudden sensorineural hearing loss, often abbreviated as SSNHL. This condition occurs when there is damage to the delicate inner ear structures, specifically the tiny hair cells or the auditory nerve pathways that transmit sound signals to your brain. While the exact cause isn't always clear, it can sometimes be linked to viral infections, problems with blood circulation in the inner ear, or even certain autoimmune conditions. Time is incredibly precious here because, for many, early treatment can significantly improve the chances of recovering at least some of your hearing. Every hour and day counts, as delaying care can unfortunately lead to permanent hearing loss that might otherwise have been avoided. So, what exactly should you do if this happens to you or someone you know? If you notice a sudden, unexplained decrease in hearing in one or both ears, particularly if it happened over a period of 70 hours or less, do not delay seeking help. Your very first step should be to seek immediate medical attention. This could mean going to an emergency room, an urgent care facility, or contacting your primary care physician right away to arrange an emergency appointment with an ear, nose, and throat specialist, often called an ENT or an otolaryngologist. Be prepared to describe exactly when the hearing loss started, whether it affects one or both ears, and if you have any other symptoms like ringing in the ears or dizziness. A key treatment often involved, especially if caught within that critical window, is oral corticosteroids. These powerful medications aim to reduce inflammation and swelling in the inner ear, which can be a primary contributing factor to SSNHL. Medical research consistently shows that starting this treatment within 2 weeks of the onset of symptoms, and ideally much sooner, can dramatically increase the likelihood of hearing recovery. Beyond that 2-week mark, the effectiveness tends to drop off sharply, underscoring just how vital prompt intervention truly is for the best possible outcome. Understanding that sudden hearing loss is a true medical emergency empowers you to act swiftly and decisively. By seeking rapid medical evaluation, you are giving yourself the absolute best possible chance to protect and preserve your precious sense of hearing. Do not hesitate, and certainly do not attempt to self-diagnose or wait for it to get better on its own. Prompt, professional medical attention is unequivocally the key to a potentially positive recovery.